In this episode of ACT Podcast by Integrated Health Services Kosovo, we explore the power of communication in contributing to healthier communities and stronger systems. We are thrilled to welcome Professor Suzanne Suggs, a leading voice globally in health communication, behavior change, and evidence-based health promotion. Professor Suggs is a professor of social marketing at Università della Svizzera Italiana in Lugano, Switzerland, and a founding member of Be Change Research Group. Her work bridges the gap between academic research and real-world public health needs, helping to craft messages that truly resonate, whether delivered through posters in a clinic or via a smartphone app. In this episode, we will talk about effective health communication. Thank you so much, Professor Suggs, for being part of our ACT podcast. So my first question would be, what makes communication effective in health contexts, addressing patients and the general public?
So, Linda, thank you so much for having me. I'm really honored to be part of this, and I hope my insights help. Regarding your first question, what makes communication effective in health context? First and foremost, it's understanding what you want the communication to do. Do you want the communication to inform? Do you want the communication to educate? Do you want it to support? Do you want it to persuade? Or do you want it to just be seen? And in some cases, that's exactly what people want, is for the communication to be visible. So first, knowing what the outcome that you're looking for, it helps you design communication that fits that objective. So that's my basic answer. Does it fit the objective? If so, it's more likely to be effective than not. Doesn't mean it necessarily will be effective, but that's the key. And then the second answer to that question is making sure that those developing communication about whatever topic or issue that they're trying to address, that they know the evidence about that issue and how to communicate about it, looking at various populations, because part of your question was addressing patients and the general public. And within those two segments, you actually have multiple segments. Not all two patients are alike, so you have different segmentation within that patient population. And then the general public, oftentimes we typically kind of group them as just the public, but within the public, there are multiple different segments. So again, knowing what you're trying to accomplish, knowing the evidence, and knowing who the receiver is.
Are there any trends or emerging practices that you believe will transform how we talk about and address chronic diseases like diabetes and hypertension?
Yeah, there are always emerging trends. When I think about your question, I think back to even when I was a master's student and I was focusing on the patient-provider relationship online because the web was quite new at that time. And then I worked in industry for many years, developing multimedia tailored health behavior change programs for patients and various aspects of the public. And at that time, we talked about the digital divide. Right? Now, the new trend is there is no digital divide, right? There still is, but people tend to forget about it. Now, the big trend, of course, is in artificial intelligence. And the good and the bad about that is that it's here, and that is the hot trend. So I do think it's going to transform how we talk about and address chronic conditions like diabetes and hypertension. I'm not yet convinced we're going to do any better with it, though. But it certainly is the hot trend and is something we need to grapple with and we need to study and we need to think about, and making sure that we're wary that the artificial aspect doesn't lead the way, that actually the real intelligence leads the way.
What is the role of the healthcare service provider versus the media?
So healthcare service providers and media both have really important roles in communication about health matters. They just are different. So the healthcare service providers truly is focusing on providing healthcare. So in most contexts, that's less about providing health information for prevention or structural changes in environment or health promoting policies at the governmental level, the environmental level, the city level. But they're really providing services. And so they are essential at helping patients and those people who care for patients, meaning caregivers, family members, friends, people maybe in an assisted living home if they're at that stage, understand what they can do to help the patient do well given their circumstances. So adhere to a therapy, understand why they've recommended a certain therapy or medical intervention, lifestyle behaviors that they have to engage in regarding, that condition they may have, such as following a healthier diet if they have hypertension or diabetes. Whereas the media, their role is really about making sure that their readership, so every, again, target audiences, every media has a readership, is making sure that their readership understands the latest trends, the latest news, the latest evidence, or the latest public opinion about a disease or a health topic. The two really do have to work together, not always because they want to, but because public opinion is often shaped by media, and healthcare providers have to work within that context. So very different roles, however, they do intersect a lot. And probably the most vivid example of where they intersect is dealing with misinformation. When a healthcare provider has to deal with information that may not be true or may not be true under those circumstances, they have to deal with that often because a patient or a caregiver or a loved one of a patient heard about it through the media.
How can various stakeholders then collaborate to ensure clear and trustworthy communication?
So that is a great question, and it's not the easiest one to answer. From a simple perspective, how can they work together? How can they collaborate? Well, first, they have to agree that they're willing to truly collaborate. And by doing so, they respect each other's position, they respect each other's job, and what they have to do under what conditions. And if they can agree to do that, then they need to set some terms for who has the expertise where and when. Not to say that I own this category and you own that category, but why are you here? What is your role as that stakeholder? Are you part of the National Institute of Public Health? Are you here as the hospital director or a doctor in a hospital or a nurse in a hospital or a staff? Are you here as the patient or the person caring for a patient? Are you here from a legal perspective to make sure that we follow the law, we get things right? Are you here from a transparency perspective? You need to understand the role that each of those stakeholders has at that table, not necessarily the role they have at a different table. So when you can do that, when you can clearly understand why people are there, what you want from them, and that we all agree to respect that, then various stakeholders can collaborate really well to make sure that what they're doing is clear, is trustworthy, and is communicated well. Now, let me just add one more thing to that. Each stakeholder also should agree that you follow the evidence so that they will use evidence-based approaches. They will use the literature to guide the communication. And rather than engage in health communication as just a creative exercise, there is creative exercises within designing effective communication, but just relying on that alone doesn't create clear and trustworthy communication. And certainly they need to agree on transparency because that also leads to trust.
How does health communication differ for the general population versus individuals who already have a disease?
So some things are quite in common, right? It's also depending on the level of knowledge and understanding one has about a disease, a condition, or illness. But it often differs because when you're designing communication for a patient, it's more relevant for them. So one of the principles, I think, in life, but certainly when it comes down to effective health communication, is we think about location, 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 right? So in health communication, we think about location in terms of how does it resonate with you? Is it close to you? What is the proximity? Close to me. I understand it because it's about me. It's about what I'm going through or what I need to do. So an individual who has a disease, communication would be about that disease or about them and what they value, right? So it's really close to them. It resonates. It should resonate with them. Whereas for the general public, it tends to be designed more for the purpose of informing and educating versus actually persuading them to change a behavior. So if I could sum that up, the difference really in the general population is the aim is often to inform or to educate, create awareness, where to a patient, it's actually to help to persuade or to support them in living well with whatever disease they may have.
Many people know the basics of managing conditions like diabetes and hypertension, but yet they struggle to put that knowledge into practice. What communication techniques have you found most effective in bridging this gap?
I love this question, Linda, because the communication techniques that are most effective are pretty simple, but too often underestimated or even ignored. because the start of your question was, many people who have a condition, they know what they should do, but it's hard to do it. And that's because the communication technique doesn't focus on the person as a person. Instead, it focuses on the person with a disease. And it doesn't focus, or it forgets or underestimates the importance of understanding what a person values, what they want in life as a whole, but also what they want day to day. So the communication doesn't always fit the day-to-day life of a person, or doesn't fit the things that they really value. So let me just give an example. Be sure to eat fruits and vegetables to manage your hypertension. Don't eat too much sugar because you're diabetic. But instead, it's, because you're diabetic, you want and you can live a wonderfully healthy life. You have to, of course, pay attention to a few things. So enjoy some sweets through this fruit or that, but in moderation. So it's kind of repositioning the communication so it really fits the person instead of treating the person like a disease. One other example that I've seen throughout my career is that what people will, in designing communication for a person living with diabetes, they will refer to that person as a diabetic. Instead, it's a human, right? It's a person who has diabetes. They have also other things too, but they don't identify as a diabetic, or they don't identify as a person with hypertension. They identify as a human being who has these things to think about in their daily life.
What was the most surprising insight you discovered while trying to turn complex health information into something that genuinely resonates with people?
So for me, the most surprising insight that I've discovered across my career when trying to turn a complex health information, into something that resonates and can be actionable is that people tend to oversimplify. So they think that taking something complex means that you dumb it down to such a level that people can't act upon it, or may not even know what you're talking about anymore. So that's my first surprise, that how difficult it is, or even how difficult it is to create a complex matter and make it more simple, and how often it is that people underestimate how important it is to not oversimplify. Now, the second surprise that I've had in this area in particular is the lack of willingness to listen. And what I mean by that is two levels. So in countries around the world, many of those who have been mandated to design health communication, so an agency that the national institutes or the federal offices have given the mandate to, they forget to give them KPIs, so key performance indicators. And so, they think that they've hired a great company who can simplify things. And because they're very creative and they've done so on the political sphere or in other topics, but they don't necessarily have the skills to do it at this topic, or they don't understand really what patients are going through, or the population's going through. So they lack the listening skills as well. So I come back to that listening. So many people that I work with, good people, forget or don't have time to truly listen. And when you can listen to people, you understand what they value. They understand how health fits into the context of how a person lives. Then you can turn something that's seemingly very complex into something that really resonates with somebody and that they can act upon. So I have a lot of hope for that, but certainly that is where I get surprised.
So, what makes a health message truly stick with people, particularly when dealing with lifestyle changes related to chronic conditions?
So what makes a message really stick with people are two things. It resonates. They understand that it's about them, that message is for them, and it's easy to remember. So we think about communications that's sticky. That means it's really hard to forget. You think about that glue on your wall that you put there for some reason, you just can't get rid of it, right? Because it just sticks, right? It's like meant to be there. So in my experience, what helps to make that message really sticky, especially when dealing with the lifestyle behavior change, is that it's based on the evidence, but even more importantly, it's about it fits what people value. So it's about segmenting communication, segmenting messages for very specific audiences so that it truly does fit them like a glove. And oftentimes you can find that out by pre-testing your communication, by pre-testing your messages that you've designed for an audience. If you pre-test it with them, and if they say, oh, that's for me, I can do it, then you probably are pretty much on your way to being there and having a good message. If they say, oh, that would work for those people, or that would work for my friend, then you probably haven't gotten it quite right yet.
On the flip side, have you ever encountered a seemingly simple health message that just didn't land with the audience? What did you learn from that experience?
Yeah, I have two examples that come to my head at the moment. One is the early days of 5 a day, right? So eat five or more fruits and vegetables a day. So 5 a day is a message that people got so familiar with, especially in the United States, where I was at the time that it was first launched. Now it's in Europe and many places around the world. People understood the message 5 a day, and they interpreted it as you should eat fruits and vegetables. But whenever you ask people, what does that really mean? They said, actually, I don't know. Is it 5 fruits, 5 vegetables? That doesn't seem right. And then they changed the messages to 5 or more. And they didn't necessarily always know what was the upper limit, and are all fruits the same, are all vegetables the same, etc. So that was a seemingly simple message that didn't really land with the audience. They've made improvements since, and most people can recognize it. Is it always actionable? It varies by target audience. Another example that I think about that's quite close to home for you and I think many of our listeners is in a first project that I worked with Kosovo. And I was honored to be brought in to just help your fantastic team design health education, communication messages. So messages that were designed for people living with an NCD, a non-communicable disease. And we were focusing on little things you could do, like, eating more fruits, switching from sweets to fruits and vegetables and things, and lots of wonderful things. And it was really, it was a pleasure to work with the team, really bright people. And the campaign, I think, was a really good campaign. But in trying to create something very simple, one of the first things that was done was almost every message showed or suggested people should eat an apple, right? And they should say no to the chocolate cake and no to the extra sugar in the tea and eat an apple. So when you looked at that individually, very simple, easy to understand, people can do that. But when you look at it collectively, every message was telling people to eat an apple. And you think at some point they're going to get really tired of apples, right? So I know your team listened to that feedback and changed that. But, that was very simple, but just didn't work, of course, when you look at the whole picture. So when you think about effective health communication, you think about the overall strategy and you have individual messages, but those individual messages collectively need to come together at some point, right?
You also work at the intersection of academia and real-world health challenges. How do you keep the human stories at the forefront when designing educational initiatives?
Yeah, so this is one of the things that I certainly love about my work is that my academic work must have some type of real-world impact or potential impact, right? So I deal with real things in life. And for me, that works just beautifully. I chose my career very well. So your question is more about how do I keep human stories at the forefront when designing educational initiatives? I think that first, it's not always easy. And it's not easy. I don't mean that because it's not something I don't want to do, but sometimes depending on the topic, people don't want their voice, to be the forefront, right? They don't want to be the poster child of a disease, for example. And so we have to find other creative ways to keep things very human. I think another thing is that I'm a professor of social marketing. And in social marketing, we take a little bit different approach than I would say traditional health promotion has, which tends to be a bit more, and I really mean this in a kind way, but a little bit more prescriptive, right? Telling people what they should do and they shouldn't do. Where in social marketing, we think about how do we market this? How do we sell this? The same topic, same idea, but how do we sell it? And we know that is often through the power of stories, that real people, and it's sometimes actors who play real people because of the topic or the situation at hand, that works. Even at the policy level, when I'm designing communication to try to change policy, we know how important that human story is. So for me, the human story is key. It's essential. I'm always thinking about how do we get testimonials here? How do we make this work so it resonates? Now, how do I keep that at the forefront? For me personally and also professionally, it's quite straightforward. It comes first, right? What I ask, what do people value? What stories do they have? How do we tell that story in various ways, right? Either through that person or in other ways. Um, at the academic level and the policy level, sometimes that can be difficult because they don't have time, and that's a legitimate concern. They don't have time to listen to people. They don't have time to get permissions for all the testimonials, et cetera. So I try to work on message framing. We don't have time to get it wrong. We need to pause a little bit. We need to be more creative about how we make sure that human story is first and foremost. And then I would say sometimes I compromise, right? So if we're all after the same cause, going back to, how do people collaborate? If we're all after the same cause, we're trying to promote health, we're trying to support patients in living better with a chronic condition, then if the evidence suggests that we really need that human story to be involved, then we got to do it. If there's evidence to suggest that we can give information and education and support in other ways, then that's what we'll do.
Explore the importance of sustaining and refining traditional options for delivering health messages. Leaflets, booklets, posters, even as digital devices and online tools become more accessible. What is the right balance?
This is such an important question that you ask. The right balance is not always straightforward, but it starts by understanding the channels that your target audience uses and how do you fit health into those channels. And it's not even just what channels do people use on a daily basis, or what channels resonates with them on a work day versus a weekend. Where do they get information about this, that, or the other? It's where do they get information, or where do they want to get information, or where do they pay attention to information under different conditions, right? So thinking about digital devices and online tools, they work really well for a lot of people for daily news. For other people, they get their daily news still from a traditional newspaper, or they get their traditional news from their neighbor or their family members at the kitchen table, for example, or in the piazza, or in their workplace, or in their faith-based organizational setting. So the right balance starts by understanding what people use and then looking at the literature. So I'll give you an example of kind of daily life type of communication, that health communication. That would incorporate where people are, where they're exposed. So if they're going to go to their doctor's office, then having health information in the doctor's office, in the healthcare setting, is really important because you're walking through the corridor. You're sitting in a chair waiting for an appointment. You may be sitting in the office of your healthcare provider, and they're talking to you, and you sometimes look at them, or you might look at the wall, or you might look at their desk and see something. They're really tangible physical objects like paper and booklets and posters can be really, really helpful. And then there's also that digital device that can help them understand things or support their daily needs in an ongoing basis. But if it's a crisis situation, the literature is very clear that people tend to go to more traditional media, radio and television, right? So the right balance is about the right situation, but then again, it's about looking at what people use and where they're receptive to information. Oftentimes, and let me say one more thing, and that is, if it's health information that people are seeking, that's one thing. But if it's health information that they need to have that they may not be looking for, that's another, right? So online information, without lots of good AI for, pushing it to people, or good other kind of meta tagging and so forth, then you need to make sure people see it. And so that's why we have kind of that push and pull. If we want people to be exposed to it and they're not looking for it, then we need other types of things like posters and flyers and push advertisements so that they're seeing it without even knowing that they needed to see it or wanted to see it, and then they can become interested in it and learn more about it.
Kosovo's diverse communities, even different official languages, bring unique challenges to health communication. How would you ensure that educational materials resonate not just linguistically, but also culturally and contextually?
Yes, Kosovo is such a diverse and very rich and amazing country. And you face this challenge like some other countries do, in that they are quite diverse. And what I've learned from my work with Kosovo and my work with other communities around the world is that the best way to ensure that health materials resonate, not just linguistically, but culturally and contextually, is to start by listening to people in each of those different contexts. I can say I've seen, not in your country, but in other places, I've seen too much efforts at creating really good health messages for one of the cultures, maybe the most numerous cultures, so the dominant culture, the one culture with the has the largest linguistic coverage, for example, and then they just translate it for the others, and it doesn't resonate with the others. It could be the way it's said. It could be the type of food that they refer to, an apple versus a pear versus, it's a fruit from this tree or that bush or something, or a way of cooking something, right? Maybe different, or a different spice, or a different influencer, or a different type of a faith leader is in the advert. So I think that the best way to do it, and I know the best way to do that, is to start by listening to people. So you look at the data, so you understand the different segments, and then listen. Have focus groups, do interviews, do some observation, and see what resonates with people before designing that final piece of communication. Pre-test it with them. Does it resonate with you? Is this for you, or is this for somebody else? If they say, yeah, that's for me, then you're much more likely to make sure that it resonates, not just at the linguistic level, but truly, contextually, and personally.
Looking ahead, with the rapid advancements in digital health, what excites you the most about the future of health communication?
Oh, that's a difficult question for me, because I've been working in digital health my entire career, and I have long been excited, and we've made such amazing strides in making sure communication is more relevant, it reaches people much more quickly, is reactive to how people behave and what people want, and we can change the communication dynamically to make sure that it resonates. At the moment, I'm a little bit more skeptical than I've ever been in terms of advancements in digital health. And let me just explain that, and then come back to also where I do stay optimistic. I'm worried that digital health is going to be too often seen as a synonym for AI, and that we put so much emphasis on AI that we forget other forms of digital health. And AI, while there is some there's reason to be excited, there's also things that we need to think about, including the incredible amount of energy that it takes to use AI. Right. So just creating a single image on AI has a huge environmental footprint. And it's not always right, too, right? And I worry a little bit about forgetting that we need to make sure people really understand things instead of have information on demand, right? So that they just, when they need to find it, they look for it versus really knowing it already. So that's a bit of my concern. Now, in terms of overall digital health, I get really excited, and I think rightfully excited, that digital health tools have the power and the opportunity to really augment what we do in public health in terms of monitoring and surveillance level, in terms of making more evidence-based decisions based on good quality, very recent data. And so I think also in terms of patient care, in augmenting that patient-provider relationship and patient-provider communication, not replacing it. If we think about replacing it, I think I get really worried, not just because of jobs, but because of what will happen to patients and physicians and other healthcare providers. But if we think about the opportunity it has to augment a patient's life, to help support a healthcare worker under already a very demanding workload by making it easier for them, making it easier to enter data about a patient, making it easier to monitor the data about a patient over time to see how they're progressing with their health issues or degressing with their health issues, so we know when we can intervene, then I think healthcare is going to be a lot smarter, a lot more cost efficient, and a lot more effective. And I think those providing healthcare and those receiving healthcare are going to be happier and healthier people. So that is something to be really excited about if we get it right. I also think that there's a lot of digital tools that are available and certainly in development that are starting to understand that we have to strike a balance between collecting data and people's privacy. So some of these devices that I saw coming out early on, if we just constantly monitor people and watch people, then we're going to be able to intervene. Yes, but also people have a right to privacy. And what I'm starting to see is some of the advancements, even in web browsers, that are not tracking every single thing you do, so letting you choose what they know about you. I think that there's a lot of hope for a really good balance that really does serve people, and people meaning both patients and healthcare providers, and also governments involved in a much better way than we could have ever done in the future. So I'm optimistic if we keep people at the forefront of these digital tools and people, both the patients and the healthcare providers at that forefront.
I would like to go back once more to the cross-cultural health communication. So based on your experiences and especially your collaborations with Kosovo, what have been the biggest takeaways in this type of communication?
The biggest takeaways that I have received in terms of cross-cultural health communication is knowing that we all have a lot more in common than not, right? We're all human beings. We all want the best for ourselves, for our families, for our neighbors. We're all a little bit self-centered, but almost everybody still has a heart and they care about other people. So in terms of cross-cultural health communication, my takeaway is that a lot of the processes to develop the communication are similar, but the actual messages that we developed have to be contextually based. So that is based in culture, that is based in the context about the disease state, when they know about it, the services provided around the disease, the language, people's history with the disease, whether that's themselves or knowing somebody else who had it. Those things are local, right? So the process to develop is very similar across cultures, even within a country like Kosovo. But the actual messages, like trying to communicate the same thing, do differ based on the context of those you're trying to reach. I find Kosovo is such an interesting country for me, and I really have a really warm place in my heart for Kosovo and the Kosovo people. And you're unique. You really are unique, but you share a lot of the same challenges as with people around the world. They may seem very different, but when I look at it from designing health communication perspective, the process is very similar.
What advice would you give to future health professionals and communicators who want to make a real impact in their communities?
So I would say go for it. Try. It's a wonderful field to be in. I think some of the advice I would prioritize is study your community. Know your community from their perspective, not from an academic's perspective, not from a health professional's perspective, but from a human's perspective. Know the reality of the daily life. Second, I would say study communication and study health. Throughout my career, I have seen all types of professionals trying to designing health communication. And I come back to every time that I see the most effective health communication is designed by people who know health first and foremost, and then they know how to communicate it. And they test it with the populations, and then they don't understand if they should roll that out or make adaptations. So I would tell them to, first, you got to love it. If you don't love it, choose another career. But if you love this field, go for it. There is so much work today and ahead of us for generations to come. Health communication is important. Whatever health profession you may be in, know the evidence, make sure that you have good training, and be humble enough to know when you don't have the training and you need to talk with other people and collaborate with them and collaborate with other stakeholders.
Thank you so much, Professor Suggs, for this insightful conversation. You have reminded us that effective health communication is both an art and a science. As we look to the future of public health, filled with apps, AI, and the ever-changing media landscapes, your reflections are more relevant than ever. Until next time, thank you all for listening to Backed Podcast.